Okay, Dr. Todd, I have the SideKick laser, which I purchased from you, and I tell you, it's a great laser. It's very portable. I can take it to events outside of the office. Can you just describe a little bit about the, just the functionality and the versatility of this laser?
Sure, Dr. Reid, I'd be happy to. The SideKick laser is a great entry-level model super pulse cold laser therapy device for clinicians. So for doctors that have been shy about getting into cold laser therapy because they heard rumors that you had to spend $10,000 or $40,000 to get a decent laser. It's just that a rumor. It's not true. Not that a $1,300 laser is the best laser for every clinician. But if someone comes to me and says, I've got $2,000 in my budget and that's all to get into laser therapy, then it's definitely a good model for those doctors to get their feet wet in it and to start seeing some results with proper training. So what this laser does, it's a super pulse laser. So it's going to penetrate 5 centimeters deep. That is the deepest that any laser is going to penetrate into the human body, okay? Now, some of your class 4s will tell you they penetrate 7 inches deep. That's marketing BS, folks. It's not true. I know the physics. Just because you don't doesn't mean you need to believe lies like that.
Right.
So,
And I think most structures that you're wanting to affect are within that 5 centimeter
within
range.
2 inches or 5 centimeters, and that's the deepest any laser is going to penetrate into the human body. Now, with that being said, there is intracellular communication that occurs. So a cell 2 inches deep can kick out a chemical that communicates with another cell 2 1/4 inches deep, which communicates with another cell 2 1/2 inches deep, etc. So we can say indirectly that there's a possibility cold laser could affect things as far as like 10 inches away, some people say. But I'm not going to sell you something based on what ifs. I'm going to sell you something based on physics, and that I actually know the physics of cold laser therapy. And I will tell you there is no laser that's going to penetrate directly more than 2 inches or 5 centimeters into the human body. But what this super pulse laser does, it's very versatile in that we have several settings. And it is very noisy when we turn it on. But setting 1 is for blood supply. So whenever I am lasering an extremity issue or teaching another doctor, a consulting client, or teaching a patient who buys one about lasering an extremity issue, we are going to use a little trick where we can work on the blood supply. So for example, if Dr. Reid here had a problem in his forearm or his wrist, we would find an area up here by the shoulder and we would laser and we would work the blood supply.
Subclavian artery?
Subclavian artery. So we're going to work the blood supply. Now with a lot of lasers, if they're not super pulsed, you cannot use this trick. Okay, so if you get a, let's say an 830 nanometer laser, that only penetrates 2 centimeters deep. It's chop pulsed, it's not super pulsed, and we can't do that trick there. So this is only a trick reserved for super pulse lasers. Another thing we're going to do, mode 2 is for either acute injury, tissue repair, or chronic injury tissue repair. So basically we have a sweep of different frequencies where we go from lower frequencies to higher frequencies, but in what we call the stimulatory range. So those are going to stimulate tissue repair. We would use that typically on the area of complaint, okay? We have another setting that is for reducing pain and inflammation. That would be mode 3 on the SideKick laser for reducing pain and inflammation. Now it is also a mode that doubles for doing things like stellate ganglion nerve block if we had a chronic pain issue, and we would also use this on nerve roots. So for example, if we had something in the arm like we talked about, we could go up here on the spine and we could laser the nerve roots in the lower cervical spine. If we had something in the knee or the ankle, we could go to the lumbar spine and we could laser the nerve roots in that area. okay?
Mhm.
So by using a laser like the SideKick laser, you can see from just what I've said here, Dr. Reid is very versatile. It's not just this, we could teach a chimpanzee to just hold the laser where it hurts for 10 or 12 minutes. And for a simple case, that might be beneficial. But for someone that has a chronic issue, or it's a complicated issue, we want to get quick results. We live in a society where people want immediate gratification.
Mhm, absolutely.
And as a cold laser therapist, I want to give my patients immediate gratification, which means in 3 to 4 hours, they notice that they're feeling better already, even if it's something they've had for 8 years and they haven't had a day without pain in 8 years. My goal is to give them at least a few hours of relief after the first treatment, and 85% of the time that happens.
Okay, great.
So
I
this
know-
laser is capable of accomplishing that.
I know there's a real art and science to the use of this, the SideKick laser. And,
Sure.
yeah, that's wonderful information.
And
Thank
then
you
the
very
other
much.
thing too is that we can, like you mentioned, it is a versatile laser. So I'm a team chiropractor for a semi-pro football team, the Springfield Foxes, and I'm also their team cold laser therapist. And so this is one of the lasers that I use on the sidelines. So once again, very portable. We don't have to be stuck plugging it into the wall in our clinic. And guess what? If the electric goes out, light a couple candles, and I'll still use my SideKick laser. So it's a great product, and I highly recommend it for people that are starting out, clinicians that are starting out on a lower budget, and they want to get into laser therapy and not break the bank, and also for patients that feel like they have $1,300 that they could spend on a at-home laser, which they could use on themselves, on their family, and even on their four-legged family members, their pets, on a daily basis or however often they want to.
Well, great. Okay, well, thank you so much for
Okay.
that valuable information,
All right.
Dr. Todd.
Thank you.